name is Sarah Kais, and I'm so sorry that I can't be with you live today, but I had a very important task to attend to, which was to bring my second son into the world, and his due date just happened to be around ACLM. But I'm really excited to have the privilege to share my experience as a health and wellness coach working alongside Dr. Serna in her clinic devoted to lifestyle medicine, helping patients achieve their healthy journey. So I wanted to start by doing a quick refresher of who I am. I know that there was already an introduction at the beginning of this presentation / workshop, but your brains might have melted from all of the awesome coaching knowledge that you've learned. So I thought I would just do a quick refresh. So I'm Sarah Kais, as I mentioned, and I'm an assistant professor at Baylor College of Medicine. So I teach full time, and I'm very fortunate because my charge in the PA program is to incorporate lifestyle medicine into the curriculum. And then one day a week, I am again very fortunate because I get to work with Dr. Serna in her clinic devoted to lifestyle medicine. And so I'm trained as a health and wellness coach, and I did my training through Wellcoaches, and no one paid me to say this, but I highly recommend the Wellcoaches program because I think it has really enhanced my skills as a provider. So Dr. Serna already talked about solo lifestyle medicine consultations as well as shared lifestyle medicine consultations. So I'm going to dive deeper into our coaching visits, which you'll see are quite distinct from the lifestyle medicine consultations. And one of those distinctions is that although we still have tons of collaboration between us, Dr. Serna and I, most of the time I'm the one who's interfacing with the patient. Of course, now that interface is really either telemedicine or telephone, but previously it was also in person, before the pandemic, I mean. So let's get started. So as I mentioned, I'm going to be covering the details of our coaching visit offerings, and we offer initial as well as ongoing coaching. And then I'll also tell you a little bit about the coach outreach offering that we have as well available to our patients. So when our patients decide to engage in coaching, we really encourage them to start with an initial coaching visit, which is about 60 minutes in length. We use that time to really do an in-depth review of what motivated the patient to decide to do coaching, what have their past health successes been, and what are their strengths that have come out of those successes that we might leverage for future health changes. We talk about their vision for their best health, and we craft a wellness vision. We create 3-month goals out of that wellness vision, and then we get to the 2 to 4 week goals. So we just drill down further and further, and that's really based off of the Wellcoaches model. And then using a shared decision-making model, we decide what a follow-up visit is going to look like in terms of length and frequency. It's really up to the patient's preference, but we usually recommend following up every 2 to 4 weeks with an ongoing coaching visit. And those visits are usually 30 to 60 minutes in length as well. So that covers our initial and our ongoing coaching visits, sort of an overview of the logistics. And then our coaching outreach calls are much less structured. They're less than 15 minutes in length. They're usually done by telephone. Definitely now they're done by telephone. And they're really great for our patients who are in maintenance or pre-contemplation phases of change, which I'll talk about further on in my part of the presentation. And we offer those at no charge to our patients. I should mention that the goal of coaching, whether it's an initial or ongoing visit or an outreach call, is never actually to make goals. It's to really facilitate an exploration of what the patient really wants for their health, what they value for their health, and to sort of muck around in any sort of ambivalence or dichotomy between where they're at now with respect to their health and where they want to be in the future with respect to their health, as well as to build an atmosphere of empathy and rapport that the patient can capitalize on. So with that in mind, I'm going to cover the anatomy of our initial coaching visit, specifically where I document and what I document in our electronic medical record. So there are 3 main areas that I document in, and those areas should be very familiar to those of you who do traditional medical visits. They are the chief complaint, the history of present illness and the lifestyle review of systems, and the assessment and plan. And we have a very specific area in our assessment and plan, which is called the preventive medicine and counseling section. In the chief complaint, I'll document whether this is an initial or ongoing visit, and then I'll document the format of the visit. As I mentioned, pre-pandemic, we really encouraged our patients to take advantage of in-person coaching so that we could pick up on nonverbal cues and really interact in that way. Post-pandemic, we're doing a ton of telemedicine video visits, so we can still kind of get some of that nonverbal cue. And then we're also doing telephone if that's really the patient's preference. Within the history of present illness and lifestyle review of systems, we document, again, what brings the patient to coaching, what strengths and successes they've had in the past that we might leverage now, what their wellness vision is, we craft that, and what their 3-month goals are. And then in the assessment and plan, that specific section, what I'll do is write an affirmational message to the patient, something really positively focused for them. And then I'll document their wellness vision, their 3-month goals, and those 2 to 4 week goals, which are in the SMART goal format. And I always put the goals in the patient's voice as well as in the present tense. So rather than saying something like, you are going to eat a cup of beans at lunch every day for the next 2 weeks, I'll translate that over into, I'm eating a cup of beans every lunchtime, every day for the next 2 weeks, which really empowers the patient to own their goal. And we send these, the assessment and plan preventive medicine and counseling section home with the patient when we're doing in-person visits, or they're available to the patient via their electronic portal. So that really allows them to have that ownership again. So here's an example of that initial coaching visit. This is a patient who we'll call SB. SB is a 48-year-old male, and he has a history of poorly controlled type 2 diabetes. In fact, over the summer, his A1C really worsened quite a bit. So it's a patient that we're all very familiar with interacting with. What's notable about his history is that he doesn't live in our state. So for a long time, he did live in our state, and he has been a patient in our practice for many, many years. But before the pandemic, he actually moved out of the state, but decided to continue to be engaged in our practice, which was wonderful. But one of the challenges we've had is that he's had some difficulty keeping full-time employment before the pandemic, and then of course after the pandemic. And anytime he hasn't been employed, understandably, he's had financial constraints that have kept him from being fully engaged with the practice. So in addition to that, some of the other challenges he has are that he tends to be quick to frustration and tends to be very focused on his perceived failures. When he's engaged, he's really excited, maybe a little too excited. But when he disengages, obviously that makes it difficult. Or when he perceives that he's failed, that can be a source of challenge for him as well. And then he faces the same challenges we all face, which is that he's busy with his work when he's employed. He has kids, he has a life partner. All of that can be difficult for making changes for him. So with him, my approach is first, because he comes and goes out of the practice, sometimes there's a chunk of time that's passed where we haven't done any coaching or medical visits at all. So I always do that initial coaching visit again, because a lot can change in 12 weeks, 6 to 12 weeks. His vision can have changed. And so we'll work together to recraft that vision. I also really work to focus on what's going well with him and affirm his current strategies, which helps to address that frustration. I acknowledge that frustration and encourage him to embrace it, but also focus on what's going well. And our visits are a great way for us to be a touch point between him and Dr. Serna. So he'll let me know what his self-monitored blood glucoses have been, as well as his blood pressure, which I can then relay to Dr. Serna. And most recently, when his A1C was really climbing, what we did is Dr. Serna created a new medication plan for him, and actually even a new lifestyle plan with one of the lifestyle medicine consultations. And then I really followed up behind that with coaching visits and reinforced that message. With SB, what's great is that he has low resistance to change. And so we can use the appreciative inquiry approach to coaching him, which is all about focusing on the positive, leveraging the strengths that he has. And what that has all led to is that his self-monitored blood glucoses are trending downward. His self-efficacy has been increasing. And our long-standing relationship with him, even though it's been on and off, has allowed us to really take good care of his medical as well as his psychosocial issues. And of course, he's had a lot of fun recrafting his wellness vision each time. So now I want to shift gears and talk about the ongoing coaching visit and what we do for that as far as documentation. It's very similar to the initial coaching visit with respect to where I document. So same sections: chief complaint, history of present illness, and then that assessment and plan preventive medicine counseling section. Except now in the chief complaint section, I'll document that we're doing ongoing coaching rather than that initial coaching. And at this time, we're not crafting a wellness vision or looking at those 3-month goals. What we're doing instead is checking in, taking an emotional temperature, seeing how the patient is feeling, how they're doing over the last 2 to 4 weeks, how they're doing today. Then we do a goal review. So we take the goals that they set at their last visit, and we really look at what successes have they had with that goal, what learning experiences have they had. We try to look at the goals as experiments. What have they objectively learned from those experiments? And then we spend some time in what's called a generative moment, where we look at where does the patient now have energy with respect to making future changes. And that is, again, based on that Wellcoaches model. And then in the assessment and plan section, I again write them that affirmational message. I'll reiterate what their 2 to 4 week goals are from their voice and in the present tense. And that again is available to them via the portal, or hopefully when we're in person again, via paper printout. So this is my example of my ongoing coaching visit. This is LV. She's someone that I've coached for several years now. She's a 42-year-old female who's had some significant health obstacles. Notably, she struggled with obesity, asthma, and migraines. But she's always reiterated to me that she wants her coaching to be focused on health habits rather than weight. So part of my strategy is to always come alongside that and really facilitate what she wants, which is to focus on those habits. She regularly sees me about every 4 weeks and then sees Dr. Serna regularly as well. She's kind of that unicorn patient. That's why I put this funny picture of the dog in a unicorn costume. Also, I just found it funny because she just doesn't have a lot of challenges with respect to actually coaching her. She's fun to coach. She's self-directed. She's a problem solver. So when I check in to find out what's going well, she always has something to say about what's going well. She loves to review her goals. She really looks at them as experiments. She's already tried different things if she's come up against obstacles. And she really leverages those experiences when she faces further obstacles. And so she really, honestly, she doesn't need a coach, but it's really fun to coach her. It builds my self-efficacy a little bit, not that it's about me. But the outcome has been that she's continued to engage across multiple years. She enjoys a really active lifestyle, which is what she's wanted. And like I said, she's overcome some significant health obstacles, but she really perceives herself as healthy and empowered to stay that way. So she's actually having foot surgery in a couple of months. And we had a conversation about the challenges she was anticipating. And she already felt really confident about, I think I can face these challenges, and I think I can get re-involved in coaching. So key takeaways from either our initial or our ongoing coaching visits are that first, they are an opportunity for a patient to have two vested parties in their care. So our patients have Dr. Serna, of course, who cares very much about their medical issues as well as their lifestyle and behavioral habits. And then they have me. And they have me and they have the time that they can then use that's devoted to exploring those behavioral changes. Many of us, many of our patients want to make behavioral changes, but don't have that devoted time to sit down and really think about what that looks like. And that's the gift that the patients are giving to themselves when they engage in coaching. It's also a touch point for patients if they have medical needs between their traditional medical visits. So many times a patient will let me know, oh, I need a refill on something, or they're having a new symptom, and I'm able to relay that information directly to Dr. Serna and get them the help they need immediately. Their needs are met by our different styles. So Dr. Serna will certainly agree that she and I have different styles and different approaches with patients. And our patients really benefit from both of those styles depending on the context that they're in. And ultimately, what we get is this very synergistic approach where we reinforce each other's messages to the patient, and the patient has their messages reinforced to us. So now I want to talk a little bit about our coach outreach offering that we have for the patients. As I mentioned, these are offered at no charge to our patients, and they're really a great way for us to stay connected to our patients who are especially in either pre-contemplation, so not really thinking about making behavioral changes at all, or our patients who are in maintenance, who don't really need someone every 2 to 4 weeks, but it's good to check in on them and just make sure everything's going okay. So my example for our coach outreach is BP. BP is a 63-year-old female. She has a history of hypertension, hypothyroidism, and non-alcoholic fatty liver disease. She regularly actually follows up with a hepatologist and a nutritionist who encourage her to engage in healthy eating patterns and behaviors. Unfortunately, though, BP is very quick to resistance. So if she senses an expert approach or she senses that someone's telling her to do or not to do something, she immediately just digs her heels in and feels as though her autonomy is being taken from her. So with BP, what I try to do is check in, find out what's going well with her, and then gently explore what her values are and her possible motivations are, and really try to connect her with her basic why for making changes. One of her other struggles is that she's really had a hard time finding that internal motivation, that core value, who she is with respect to why she wants to make those health changes, which we all know is really how patients make sustainable change. So we try to gently explore that within those 15-minute calls while avoiding what I'll call shoulding. So shoulding is when a provider or a patient says something like, I really should eat more vegetables, or I really should eat less red meat. They're just kind of expressing to you that that is all coming from an external source. And so I facilitate moving away from that shoulding and more towards just, hey, what are your values? What do you want for your health? While also trying to build some self-efficacy. So the outcome of that is that she really knows that she's supported and that when she's ready to make a change, her care team is going to be there for her to do that. She knows she has a non-judgmental, empathetic ear listening to her. So she's honest about her health behaviors and she feels safe talking to me about it. And actually, in early 2019, she really connected to a faith-based why for nourishing her body better. But when the pandemic happened, we really lost some of that connection. But luckily, we've had that in the past. So again, I'll always try to connect with those past successes to leverage future change. So with patients like BP who are really in that pre-contemplation phase, these are great offerings that we have for them where we just get a conversation started. And then, as I mentioned, when we have patients who are in the maintenance phase of change, these are great offerings because we're able to anticipate any sort of relapse. We're able to talk about what's going well, what they're anticipating for challenges, and then we're able to make a plan for that within those 15 minutes. So key takeaways from our coach outreach offerings. Regular contact with all of our patients. I actually have a designated list of patients who have either engaged in coaching or would benefit from coaching, who I call at least once a month. And Dr. Serna and I go over that list regularly. It's an opportunity, as I mentioned, for those patients who are in pre-contemplation or maintenance. Our patients are engaged even if time is an issue. So if they don't have time for that 30 to 60-minute visit, 15 minutes calling them, that really ends up working out well. And we'll actually sometimes even put those calls on the schedule so that we don't play phone tag with the patients. Patient needs are met. And as I mentioned, this is offered at no charge, and we document it as a telephone encounter. So with that, that concludes my discussion about our coaching offerings to our patients. It's been lovely to get to share my experience with you all today. I'm going to kick it back to Dr. Serna, who is going to talk about the collaborative opportunities that we have within our practice, both as a summary of what we've already talked about, as well as some other opportunities that we take advantage of with our model. Thank you so much.